Welcome to Your Pharmacy Career podcast, proudly brought to you by Ravens Recruitment, Australia's leading specialist pharmacy recruitment agency. The podcast series has been created to shine a light on the diverse and inspiring careers of Australia's pharmacists. Each episode will focus on the varied career opportunities within the pharmacy industry by exploring the career paths taken by leaders in the fields of community pharmacy, hospital, industry, government and professional organisations. Careers never follow a defined path. Everyone's story is different and unique in their own way. The podcast series will help you discover the world of opportunities that exist and reveal pathways to achieve your dreams and aspirations. Whether you are a pharmacy student, early career pharmacist, or simply looking for a change at any stage of your career, the podcast series is designed to help you navigate ways into a career and a life that you love. Your host of the podcast series is Ali Sue. Ali, herself a pharmacist, is now the founder of Global Pharmacy Entrepreneurs and a passionate advocate for pharmacists to grow, innovate, excel, and make a lasting impact in the world. It's now over to our host, Ali Sue.
Welcome to Your Pharmacy Career podcast. This is Ali Sue. In the spirit of reconciliation, Ravens Your Pharmacy Career podcast would like to acknowledge the traditional custodians of Australia and their connections to land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Today's guest is Dr. Ramesh Walpola. He is a pharmacist, certified health manager, and the pharmacy academic lead and program authority at the University of New South Wales School of Health Sciences. Dr. Ramesh's primary research interests and expertise lie in patient and medication safety, with a focus on the social aspects that influence secure practices. In 2016, he completed his PhD at the University of Sydney, where he concentrated on creating educational interventions to foster generational change in patient safety practices within the pharmacy setting. This innovative work earned him the FIP Young Pharmacist Award for Professional Innovation in 2012. After his PhD, Dr. Ramesh took on various clinical research roles, including a multi-center deprescribing randomized controlled trial, the development of interprofessional student-led clinics, and a review of the junior undergraduate pharmacy practice curriculum at the University of Sydney. His current research covers several areas, such as patient and medication safety, safety culture, health professional education, and patient experience, with an emphasis on vulnerable populations. Dr. Ramesh is currently spearheading the implementation of the new pharmacy program, which is a part of a collection of new and revamped health professional programs. In this conversation, Dr. Ramesh shares his personal journey as a pharmacist and offers insights into the future of the pharmacy profession. Without further ado, let's welcome Dr. Ramesh. Welcome, Dr. Ramesh, to join our show. Can't wait to dive into your pharmacy career to help our pharmacy students, early career pharmacists, to create a successful pharmacy career.
Hi, everybody, and thanks for having me. It's a great pleasure to be here.
First of all, congratulations on receiving the Education Innovation Award by the University of New South Wales.
Thank you so much. Yeah, it was something I didn't really expect, but it was a really nice achievement after a few years of work.
We know the award is recognizing staff, but leading the innovation, designing and developing new courses and learning education activities. What have you been working on in the past few years? And what's this new innovation that you're bringing to our pharmacy industry?
Thanks, Sally. The award was given to myself and a number of my colleagues, recognizing the achievements that we have made in the development of 4 brand new health professional programs, which we're launching at the University of New South Wales. As you can probably tell, there is a huge need for not just medical professionals, but also the whole range of allied health and other primary care professionals like pharmacists. And so what the university realized was that to meet this need, we obviously need to have more students entering the workforce. That's something that's also come from industry. I can honestly tell you, since I started undertaking this particular project, I've had industry leaders come to me say, "Can I take on more students? Can I take on more students?" And we hadn't even launched the program. So the award itself was for the innovations that we had developed as part of developing these new programs. In particular, we've developed a new curriculum which is highly interprofessional. So the curriculum itself has not just interprofessional learning as a tokenistic component as part of maybe communication training or as part of a series of case studies. We actually have 8 subjects in which our students will be studying with students from other health disciplines. And that includes the whole array of health professions that are taught at UNSW. So developing this curriculum from scratch was not a small undertaking, as I'm sure you can imagine. And we had a very small but interprofessional team working together to actually, I guess, bring together all our strengths and understand how best we can not only develop this curriculum, but how can we implement it so that our students really see the benefit of working interprofessionally as they progress into their career, which is really part of that modern ethos of healthcare. And so we're hoping to really instill that modern ethos of healthcare into our students from day one. Literally, workshop one is the interprofessional workshops teaching our students, the basics of academic skills. As we move through the rest of the program, our students are actually going to get training around case studies, working interprofessionally as well, and doing debates and doing lots of fun activities with our students from a whole range of disciplines. We're even bringing on board the medical program as well. So it's been a huge undertaking for our very small team. And now that we're launching, we're also going to be growing the team, obviously, to deliver these new programs that we've developed.
What does that look like, the future for our pharmacists?
We are in a fantastic time right now. We're starting to see a lot of change that has been talked about probably for the last 10 to 20 years actually coming to fruition. So for a young pharmacist, I think this is the best possible time to come into the world of pharmacy, because you not only have all this great knowledge that you've got from university or continuing professional development, but you can actually start using that to your full scope of practice and really show the true benefit of that training that you've received as a pharmacist. I think, with prescribing, for example, I think we do need to be upskilled in a number of new areas, and I think that's a really exciting time. Like, for example, for my students now, I've insisted that all my students take training in anatomy, which is not necessarily taught to that level in many pharmacy programs. I know definitely when I studied, I did very basic anatomy, but we didn't necessarily have that same depth of anatomy that we're going to be giving our students in this particular course. So I think it's really important that students realize that as we take on these brand new scopes of practice, we also do need to upskill our knowledge, and it may even be going back to basics in some instances, like understanding, functional anatomy before we can actually do examinations skills and teach our, not just pharmacy students, but also graduates who are working, who are going to upskill to do prescribing, to be able to do examination. You need to have that core understanding before you need to be able to walk before you can run. So that's, I think, a really important thing that we are doing here, at least, is we've been able to incorporate a lot of that sort of foundational knowledge into our brand new program, having a new program from scratch. But not just selling the program. I think it's a really exciting time because we are going to be able to have graduates who want to take on new roles, who want to gain more knowledge and are really eager to learn. They're definitely going to be the ones that are going to be doing all these new courses and programs to upskill themselves to take on these new roles. They're talking about pharmacists in aged care facilities as well, which is, I think, really so needed. One of my past jobs was actually being involved with aged care facilities, being based in a hospital, but working with aged care facilities on a particular project. And honestly, after that particular experience, I just saw the benefit of being a pharmacist going into aged care facilities, being in-house, even though I was only there for a couple of hours a week. Just being there for that couple of hours had a huge impact on medicine use, and the benefits to the patients was actually something that you could visibly see. You could see them having better interactions, reducing the prescribing of psychotropic agents. I still remember one particular patient, or the family of this particular patient, I should say, who basically said they'd lost their mother for the last 2 years, and now they were able to actually have their mother back. And that was such a powerful thing to sort of hear and see and feel. Taking people off their medicines, which were unnecessary, they were having better health outcomes. They were having better relationships with their families. It was a fantastic outcome for the family, was a fantastic outcome for the patient and their quality of life. And I think it's a win for us as a profession as well, because we've made a huge impact on people's lives, and reducing also costs to the health system by reducing unnecessary medicine use. So whilst it might be a very fractional, a minuscule amount of savings to the PBS, it's still some sort of saving as well. So, we definitely have benefits that we can bring across the spectrum. And I think, now is a really great time to be in the profession where you can actually champion these new initiatives that are starting to be implemented.
You mentioned industry. So I'm just curious for our early career pharmacists or pharmacy students who don't know much about industry, what does that look like? What skill sets do we need to gain? I've noticed you were a senior lecturer in health management. What does that mean in the management of health as a pharmacist?
My role at the University of New South Wales has evolved. So I previously taught at another pharmacy school in Queensland, and had great a great time teaching up there. But I was not necessarily, I think from my personal perspective, my family was in Sydney, and I didn't necessarily have the support mechanisms in my life that I wanted to have around me. So I made the move back to New South Wales. And when I was an academic, and what I did my PhD in, interestingly enough, was in the whole area of patient safety and medicine safety. So that's what actually got me into the sort of health management sphere, was coming to health management from that safety sphere. So as part of health management is somewhat of a broader discipline. It encompasses a number of different aspects around leadership, around clinical governance, which was a course I used to teach, around policy was also another course I used to teach. So it was bringing together all these different aspects of things that I was doing as part of my professional roles, and I sort of moved into teaching not just pharmacy students, um, but students from all health disciplines, and even beyond. So I had students from a finance background, and also patient advocates actually coming and doing that degree program. So I found being part of that health management program was a really fantastic thing for me. It was actually very professionally rewarding for me as well, because uh, I was obviously translating my professional experience to a whole range of other students, albeit I still feel I'm very much a pharmacist at heart. So I'm sure that there's a lot of pharmacists who are listening to this and contemplating where they're going to take their career next. I actually really loved doing the health management training. So I also have an associate fellowship with the College of Health Service Management, and also through their certification program, I'm a certified health manager. So that's something that I found really beneficial to also be part of this other organization, which also allowed me to have, I guess, further professional growth as well, not just sticking within pharmacy, but I found, it's not so much of it's not really moving out, but it's adding to that skill set that I already had. So I guess I was using my research knowledge and research expertise to teach health management at UNSW. That is, I guess, one particular side of the health industry, so to speak. So it's very much around health services, looking at how can we optimize care in health services, improving quality of service delivery in hospitals, but not just hospitals, in primary care settings, in other community care settings, such as community outreach clinics, for example. So I really enjoyed being part of the School of Population Health and delivering courses in um, health leadership and management. But in terms of, I guess we need to think about health. It's somewhat of a spectrum. You've got the service delivery side of things, which is one part of the health industry. I think when people hear the word industry, they think of pharma and the pharmaceutical industry, which is a completely different, I guess, sector, so to speak. But we all integrate and all work together. In terms of skill sets, going back to your specific question, I think having a really broad set of skills is really important. What one of the things that I've learned, particularly as an academic, is even the knowledge that I had when I was a student, and even as a practitioner, even though I've been out of practice for I think probably about 3 or 4 years now, or working in a clinical role on a daily basis. Um, I really see that having a broad set of skills is really important. All those what students used to and academics for a while used to think of as soft skills, um, are actually so important and do really translate across industries. And that's one of the things that I think, as we've developed our programs, we've really realized that students need so much more than just the clinical knowledge and the skills to do the specific tasks that you require for a particular profession. You need to have really solid communication skills. You need to have an understanding of business, and the business of healthcare, regardless of whether you're a clinician working in the front line, or whether you're a manager, or whether you're working in the pharmaceutical industry. Having some business acumen is really important, and that's something that you're going to see a lot more courses around the country increasing um, their content in is some sort of business skills and understanding the business of healthcare. Around the world, we're looking at this concept called value-based healthcare, which is really it's something that has come out from America, but it's really about getting the best bang for buck in terms of what we're investing our money in at the end of the day. And we've got finite amount of resources at the end of the day. And even if you're working in a community pharmacy, we have, a very finite amount of resources that, that you can put into the business itself. So we all want optimal patient care. So understanding those, I guess, business principles is going to be really important as healthcare evolves. Health budgets with the government are fairly finite, as everybody knows. So it's how do we best optimize the care that we can give with the resources that we have, which is, I think, a really important thing that we need to start thinking about as well. So it's not just developing all those clinical skills, it's also important to understand business skills, entrepreneurship, being able to be an advocate, understanding some of those public health skills. So understanding policy at different levels. Even if you're the one that's implementing a policy, you should have an understanding of how it all integrates. And nowadays we're having a lot more regulation on practices. We have a whole series of new standards being released by the Australian Commission for Quality and Safety in Healthcare. So we as a profession need to actually start incorporating all those standards, because that's what we're going to be audited against and reviewed against. And if things go wrong, that's what's going to be cited in a court of law. So it's really important that we understand all those basic principles relating to public health, health leadership and management, as well as all those clinical skills to actually deliver optimum care, whether you're working as a frontline clinician, or whether you're working in a management role, or whether you're working in the industry, supporting that from another perspective.
We're very practical in this podcast. Our listeners
Yep.
wanted to know how to gain the skill sets, how to get into those opportunities. For a student who's finished a pharmacy degree or they're working in a community pharmacy, what's the best way for them to gain this knowledge, whether it's business, public health, to understanding the big picture?
I think one of the things that I have learnt later in life is I think it's really important to firstly understand your strengths. And this came about actually through a friend of mine who was doing the MBA. They were being trained to be a coach and learning how to be a coach. And one of the things they did with me, which I found really helpful, was there's a tool called the Clifton's Strength Finder test. Um, you have to pay for it. I think it's about $35, but don't cite me on that. But I found that really helpful to actually identify what were my personal strengths, and it also helped me sort of think about where best should I actually, tailor my career. Like, I think it's important to understand what are your strengths, because that's going to help you um, be really employable if you can demonstrate to employer what your strengths are. At the same time, obviously you want to do things that are interesting, but I'm probably swaying off topic, talking about interest. But I think, having an understanding of that is a really good first step, as to, how you're trying to shape your career. Understanding your strengths, understanding your weaknesses as well is really important. Doing the old SWOT analysis. Um, I know everybody's heard of it, but it actually does really help. And it's something I used to do with my students, when I used to teach pharmacy, actually, was get them to all do a SWOT analysis of themselves. And they used to hate me for it. But hopefully it really gave them an opportunity to reflect on what they do really well, what are not things that they do so well, um, and what other opportunities can they have, as well as, threats to those opportunities as well. I think in terms of you as an individual, you need to also, as I know a lot of people hate doing this, but reflecting on where you want to take your career, because that is going to be a huge part of this process. You need to understand where you want to go before you can upskill in these particular areas. So I think when I finished university, I always describe my career as being serendipitous, because I seem to have opportunities that sort of came up and I would say yes to everything. And that's what led me down different pathways. I honestly had no intention when I left university to end up as an academic. That was something that I did not have planned, but it was literally through a series of steps that has actually ended up, and resulted in me taking this particular path. So um, along that way, I was doing things that I was, I guess, using to help me find the path that was best for me. Like, obviously, I did some high degree. I was tossing up, do I do a high degree in sort of, public health and health leadership and management? So I was really interested in public health. Um, but at the same time, I was tossing up, should I do, some research? And it was honestly some experiences that I had whilst locuming, and where I saw some really poor practices that actually shifted me to that research pathway, because I wanted to actually do something about it. And I had spoken to one of my mentors, and they sort of said, you need to actually build the um, body of evidence before you can actually create the change. So that's what I essentially set out to do, was to try and build a body of evidence to actually create the change. Um, and since then, I sort of fell down that sort of research pathway. It was completely unintended. But obviously, to become a researcher and to also be involved with policy, I had to sort of upskill in those kinds of areas. You can do, master's programs or shorter programs. Like, obviously, I can talk about the UNSW program since I work here, and it is great. So, I'm very happy to talk to people if they want to hear more about it. But I think it's really thinking about where you want to take your career as to what particular things you upskill in. One of the other things that I found really beneficial is joining professional societies, um, from an early part of my career, to actually get that sort of insight into the different aspects. So, for example, joining the College of Health Service Management, as I sort of started to transition into this area, really helped me understand what were the things that I really need to know or need to understand in this particular role. And as a college, they were really they're very supportive. They run webinars pretty much every single week on different topics. And so it really helped me gain an appreciation for the scope and breadth of a role of a health manager, which I didn't necessarily fully understand until I started engaging. So I would strongly recommend people who are trying to think about shifting their career or moving um, into another aspect, finding professional bodies, or even if you don't want to join a professional body, think of finding a mentor in that particular space, approach them, and I've had lots of people approach me for mentoring. I've had even, the other week I had somebody who I went to uni with and did my undergraduate study with come to me and say, I need some mentoring and I need some advice, and can you help me think about how I can, structure my career moving forward? And I've always been very happy to try and help people as much as I can within my workload. I think finding a mentor, there's a lot of people who very generously give their time to actually meet with you on a regular basis to talk through, your particular conundrums and what you want to do moving forward. And sometimes it's really good to actually have that conversation with someone and have that relationship with someone, sometimes someone you don't know on a personal level, because you can sometimes open up and they can look at you from an objective perspective and give you that fairly objective advice without knowing you as a person too much. It goes both ways. Sometimes it's really good to have someone who knows you personally, and sometimes it's actually really good to have someone who doesn't know you so well personally. I still have a range of mentors that I still use and still go to for advice, and some of them are more formal, I guess, mentors, and others are more informal mentors as well. So I think from that kind of perspective, finding a really good mentor is going to be really helpful to your career as well. And you're going to have lots of different mentors throughout your career. So don't necessarily, if you meet one person and you don't really gel, don't worry about that. You're going to find lots of different mentors who are going to help you grow as a person, professionally and personally as well.
Wow, amazing. I can see why so many people coming to you ask you to be their mentor.
What I do with the people who've come to me is I like to take the approach of helping them make the decision themselves. And I think that's a really important thing when you're finding a mentor, is you need someone who, I guess, can help you come to that conclusion yourself rather than necessarily tell you. And I know sometimes when we're young and particularly of certain generations, you want an answer really, really quickly. And you sometimes can't necessarily get that answer really quickly. You have to actually work through it. You need to reflect on it, and then you need to come back to, your particular decision. Sometimes we do need to make quick decisions. That's just part of life. But sometimes, when you're trying to make these long-term decisions, it doesn't necessarily work out best if somebody tells you exactly what you should do. I find, this is just my experience, other people may have different experiences, but I really like to help people come to their own conclusion. I sometimes tell them about my experiences and things, and just get them to reflect on, how that might relate to their own particular circumstance. And, I don't know all the answers. So, it's always good to bringing in other people who may have a better idea about something as well. So I think if you find a really good mentor, they're going to really support you throughout your career wherever you go. So that's probably something that I'd recommend. But yeah, those are probably the three things that I'd probably consider. One, probably to sum up, one is probably doing that sort of self-reflection activity to identify, what you need to actually, what you want to do and where you want to go, so that you can identify what areas you need to upskill in, but also to get that appropriate advice and, get involved, join professional societies, and find someone who can mentor you through that process.
Wow, thank you so much.
Thank you for listening to this episode of the Your Pharmacy Career podcast, proudly brought to you by Ravens Recruitment, Australia's leading specialist pharmacy recruitment agency. If you enjoyed this episode and know anyone else who you think would benefit from it, we would be grateful if you could share it with them. Together, we help even more pharmacists develop a career and life they love. If you have any questions or suggestions about future podcast episodes, please reach out to us via email info@ravensrecruitment.com.au.